Start working on not touching your face, because one main way viruses spread is when you touch your own mouth, nose, or eyes.
Newspapers and magazines, television, and social media platforms would all be considered forms of mass media. Communication in which messages are transmitted to many people through print or electronic media. Mass media is used to communicate and share information. How do you know if that information is based on fact and truth when media can be fluid and pliable? According to Pew.org, media mistrust has been growing for decades, contributing to the polarization in society. A major example of how media can distort, mislead, and cause mass confusion came to light during the COVID-19 pandemic. Media, along with keyboard cowboys, often shared misinterpretation and misinformation about COVID. A writer for the Association of Science Communicators, author Stephanie Vitalis, explains that what begins as a well-documented scholarly journal written by a scientist will eventually be watered down or misinterpreted as it moves from the scholarly article to a press release, to a media news report, and then on to social media platforms. Originally written in scientific language for other scientists to review, it will be condensed to more layman's terms for the article's press release. Then it will be sensationalized to grab the news media consumers' attention. Lastly, it will be shared through social media platforms an infinite number of times, which can lead to more language and nuance changes, causing major misinterpretation and misinformation. In 2020, misinformation spread like wildfire through all types of media. The world was in a panic and many were full of fear. Media outlets offered conflicting information, and it became harder to discern truth and fact from fiction. We received mixed messages about herd immunity and if it was or wasn't scientifically proven to work. Well-known YouTube sensation Jake Paul seemed to accept the theories of herd immunity and was highly criticized for the massive party he threw in his Calabasas mansion. In Tuscaloosa, Alabama, college students were throwing parties, where each attendant puts money into a cash pot, and the first student to get COVID-19 would win it all. There were mixed messages about what medications or cures were available. In Arizona, a man died and his wife was hospitalized after ingesting hydroxychloroquine, an additive that can be used in fish tank cleaner. This was after a group of doctors, calling themselves America's frontline doctors, and President Trump had touted the miracle benefits of using the actual drug itself. Due to false media reports in 2020, hundreds of people in Iran died from alcohol poisoning. This was caused by the misconception that ingesting alcohol would either prevent people from getting COVID-19 or help them heal faster. The media frenzy even impacted supply chain problems and left the store shelves empty. Toilet paper, rubbing alcohol, and hand sanitizer were in short supply. The media was so mixed up and conflicting, it was very hard to navigate the truth. Vaccine or unvaxxed? Mask versus no mask? Schools open or schools on shutdown? Herd immunity versus social distancing? Let's be honest. Of course, people were trying everything they could to keep themselves from either getting COVID-19 or curing themselves from it. When you have the media revealing to you the next batch of 5,000 body bags and refrigerated trucks to be delivered for the deceased victims of COVID-19, of course people were terrified and willing to try anything to stay alive. During the pandemic, the National Library of Medicine stated, "Unfortunately, misinformation has a further burden on controlling the situation. It could lead to rumors, stigma, discrimination, false theories, and shapes beliefs and attitudes, ultimately creating confusion that curtails the advancement of individual health and public health during crisis." Since the pandemic, vaccine hesitation has risen, quite literally an example of the hypodermic needle theory. Always keep in mind that media is often posted to get likes, and you're more likely to like a post if you already like the person or organization that posted it. But it doesn't necessarily mean that what they've shared is factual or truthful information. Do your own research. When it comes to health concerns, talk to your doctor or a medical professional before believing in something you've seen through the media. From political stories to flat earth theories, cure-all supplements to the latest miracle weight loss products. Do your own research.
Dodge! You heard what the scientist said. Get your diaper up over your mustache area.
I'm not wearing a damn diaper over my nose.
Don't you care about me?